Hello, and welcome to the video to celebrate Scleroderma Awareness Month for the Waiting Room Entertainment. We're so excited to be here and to celebrate with this wonderful group that is a rare disease organization that supports care and advocacy in rare diseases. And I'm Lesley and Saketkoo, and most folks know me if you've been participating in patient education conferences and education modules. Usually, I guess you hear me talk more about empowerment and mindfulness and exercise, but I really wanted to put myself out there this month for clinical trials and research. And this is our second video with my dear colleague, Reggie Mister, who is the Regulatory and Contracts Manager for Delricht Research, and he's a very important person on the landscape of scleroderma clinical trials. Our first video, we talked about what is a clinical trial and what does that mean for a patient. And in this video, we wanted to talk about fairness in research for rare diseases, and how we as patients organizations, and investigators, how we can advocate for a better landscape in research, especially given that that rare diseases are incredibly underfunded, and we cannot afford to lose the little money that we're allocated to just trickle down the drain with wasted time. So Reggie, I want to say that I'm so grateful to find you, because I think it's never been as I've never had such a wonderful experience in getting a clinical trial up and running in a good amount of time, and patients having an interest, and then they're easily evaluated for the clinical trial, and you've really made sponsors very happy, because the turnaround time is so quick, matter of weeks, when some of my colleagues, and the way it used to be for me was months, sometimes 9 months of waiting for a clinical trial to get up and running. Can you tell us a bit more about that, the process, and where that's getting caught up?
Yeah, definitely. And, first of all, thank you for having me. I'm excited to be here for the second video, part two. Excited to, celebrate this awareness month with you and in our, scleroderma patients. As you mentioned, our institution, Delricht Research, we take a lot of pride in, speed, and not only speed, quality as well. We don't have to, sacrifice quality in the pursuit of speed. I think both can, be obtained simultaneously. What we see, especially in rare diseases, a lot of holdups, time, huge time consumptions working through the startup phase of a study with institutions. How Delricht works. We get a study award, right? Someone says they, want to work with us on XYZ study. That same day we're providing responses. They once they send us the contract for that, often, definitely within that same week, but sometimes even the same day, we're returning that to them for revisions, and often, fully executing contracts within, 1 month. I know, Dr. Saketkoo, you mentioned, some institutions, you see 9 months, 10 months, we're doing it.
And by then a clinical trial is sometimes closing, and They never get a patient. And the worst is that we keep waiting and waiting for our institutions to approve a study, when it goes through finances and regulatory, legal, ethics, and it gets stopped on somebody's desk, because they don't realize how important it is in rare diseases, that we're losing time. And then months go by, and patients are, and we're thinking our patients is going to be able to get in this trial any minute. So we're continually negotiating. Should we start a different treatment, or should we get you in the trial? Should we start a different treatment, get you in the trial? And that becomes very nerve-wracking for an investigator, because your patient needs to get treated, but your patient really wants to be part of the clinical trial. So,
Yes, that's something we realize, at the end of the day, the patient is who suffers. There is a patient waiting for us to, approve a trial, to complete all the necessary steps to get that trial started at our
yeah,
center. So we're always going to be quick to move through, the regulatory phase of setting up the study, the finance phase of setting up the study. The quicker we can get that study up and running for you, Dr. Saketkoo, the faster that patient is going to, get treatment, regardless of whether they receive placebo or, study drug. Is utmost important to, really shrink that time between getting a study awarded to us or identified and actually seeing that first patient.
yeah, thank you. And these trials, they cost millions of dollars. And when a trial gets held up or a site gets held up trying to get activated for a clinical trial, that's sometimes hundreds of thousands of dollars
Millions.
a month. Hundreds of thousands of rare disease research dollars are going down the drain because people still need to get paid. Vendors still need to get paid that run the study. And that again, like you said, it ends up hurting patients in the end.
Yeah, it's a tough pill to swallow, especially considering, as you mentioned, rare disease is underfunded to begin with. So any wasted money is, I think, multiplied when you consider that we're underfunded to begin with.
Yeah, I think that's super important. So then we think about, well, what can we do? What are the options in these cases? A few things come to my mind, but I'd like to hear what you have to say, Reggie, and then I'll give you a piece of my mind.
Yeah, sure. I think, one of it is, I think sponsors, have opportunity to, prioritize those institutions that are, quick to move through. I think that really incentivizes and moves the industry, in the right direction. Focusing on institutions, those sites where, they can, move through the startup phase quickly. Obviously,
Get it up in a month or two.
Exactly.
And things aren't hanging around on anonymous people's desks in a pile that's not gotten to for weeks and weeks and weeks.
That's exactly right. Yeah. At the
Mhm.
end of the day, we see that there's really no reason for trials to be held up, for really any reason. I think we have the same discussions as other institutions. We're just quicker to have those discussions and quicker to come to an agreement with our sponsors. So I think that's one way that we can kind of move in the right direction.
Yeah, exactly. And I think making research staff, like a concerted effort to make research staff in different departments really understand the toll that the delays take on rare diseases and the patients, that kind of awareness may be able to make a change. But sometimes, I think there has to be external rules and policies put in place in terms of like with outside of departments, saying like the institution says that this rare disease studies have to get through legal within 5 days and then passed on to budget. The budget has to be resolved within 10 days, and those are strong, and or that there's just generally a fast track, that other studies get put on hold as a rare disease studies moving through those steps.
Right.
That's another option that can be taken by institutions. But also, we're talking about places where they're large, and the folks that are handling these important tasks can be anonymous, and there's little accountability. And so that's an important place for the government to step in and, and protect their dollars and protect rare diseases and say, listen, if you can't get a trial set up within 2 months, a principal investigator has the right to take the study to an independent clinical trials unit, because we're talking about patient life years. We're talking about really challenging situation in terms of availability of funding. And this is really crippling rare diseases research. and so I think those are, and it's always good to go to Capitol Hill anyway and fight for more funding,
Yes,
and say fighting, there is a Capitol Hill Day for rare diseases, and there's a day for diseases that are fibrosing, of which Scleroderma is one, and we can go and visit senators' offices and representatives' offices and share about the disease. So get involved with your local groups to learn about what you can be doing to advocate for fairness in rare diseases in research. Was there anything else, Reggie? It's always great to talk to you, and enlightening and heartening and hopeful to talk to you.
yes, always a pleasure. I always look forward to these moments. I don't think there's anything else I have to add. I think we could talk about this for hours and hours, which sometimes, right? So I think we covered the main points.
Yeah. Well, thanks, Reggie. You're wonderful. And I can say for you too that we're very grateful to be here, and we thank the Waiting Room Entertainment, this wonderful rare disease organization that's really helping empower patients. Thank you. And we'll be thinking of everybody during Scleroderma Awareness Month.
Absolutely.
Thank you, Reggie.